Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. Today, I want to continue on with my videos on late term side effects from cancer treatments. Today, I want to talk about the lungs. And with that, I do want to offer this disclaimer that I'm not a doctor. So I'm not giving out any kind of medical advice. I'm simply retelling my experiences of what I've been through. And I do need to caution because even though my treatments were given 37 years ago, they're done much differently today than what they were decades ago. In fact, probably even 20 years ago, it's different. They've learned how to use radiation more efficiently, more safely. So it's to give you an idea, as I expressed in my heart videos, I was treated what they call upper mantle, which comes from my jaw down to just below my rib cage. Also from shoulder to shoulder. So that whole area was irradiated. Got my heart, I've already made those videos. My lungs were also in that field. Today, when you're treated, and it doesn't matter what cancer, I was treated for Hodgkin's lymphoma, but you could be treated with other kinds of cancers. You are now basically going to be shielded as best as you can, and that radiation is going to be directed specifically at specific targets, tumors, whatever. They didn't do that decades ago when they treated me. My whole area was exposed to it. So, whatever area is exposed to that radiation, and if for some reason it is the lung area, this is information that I feel I want to share with you today. Now, there was also a chemotherapy drug that was given to me, and I do believe that they still use it today, called bleomycin. Again, it's a chemotherapy drug used in treating Hodgkin's lymphoma. So this is a chemotherapy drug that can cause scarring to the lungs. It can cause some issues. So I want to go a little bit into the issues that I deal with. I mentioned scarring. I have something called restricted breathing. Now, in my heart videos, I talked about shortness of breath. So I have actually two different issues when it comes to breathing. That's shortness of breath, which is when I do any kind of physical activity, whether it's carrying something, whether it's walking, tying my shoe, I'm out of breath. Okay. The restricted breathing occurs when it's hard for me to take in air and breathe it out. Usually, this happens in extreme weather conditions, such as high heat and humidity, or extreme cold and wind. Those two things are liable to create this. What happens is I can best describe it as basically an asthma attack. I've never had asthma, but I know the doctors have tried to treat this issue with inhalers. So when I've asked people who actually have asthma the way I describe it, they're saying it's kind of the same thing. I do not get any relief from inhalers, so this is radiation damage. I also have something called radiation fibrosis. I'm going to encourage you to look that up for a better in-depth explanation of what exactly that is. I just know that that's on my chart. I also had two different rounds of pneumonias back in 2012. These were brought on by gastrointestinal issue. So I'm not going to get too far into the weeds with that because that GI issue will be done in another video. But I did end up with pneumonia and two pneumonias. And it was then that it was discovered that the lower left lobe of my lung is no longer functioning. I had to make sure I didn't say the D word and get in trouble with TikTok, but basically there's nothing going on with that lower left lobe. And then also, it was discovered that I've lost about a quarter of my lung capacity. And I'll get into what that means shortly. And then finally, The last thing that I'm dealing with are these nodules on my lungs. And I've already talked in another video about my heading down the road towards lung cancer because of one of these nodules. This nodule that's being looked at was discovered back in 2008. That's how long it's been. But it wasn't identified back then. It was so small and they couldn't tell what it was. But I was put on an annual surveillance of CAT scans, and the idea was to watch this thing grow. How fast, what kind of shape it was in, if they could tell what it was. And they would just watch it and determine later on. The thing is, over the last 3-4 years, it has doubled in the speed of which it's growing, and it's also increased much quicker in size, that it's now being labeled as very suspected of being lung cancer. My pulmonologist and I are on the same page because there's only two ways to guarantee diagnosis for sure. One is with a biopsy, and the other is with surgical removal, what they call a wedge surgery of that part of the lung. I lost my father to lung cancer, although his was for smoking, not radiation. And it was because of that experience that I have put the brakes on pursuing this diagnosis. Doing the biopsy, there's a risk of the lung collapsing, which is not a good thing to happen, especially with my health history. And honestly, doing the wedge surgery has its own risks with my health history. My pulmonologist and I are both on the same page that we're comfortable with letting this grow some more. It's described as, this nodule is described as indolent, which means slow growing. So for many people, this type of nodule could never end up being a factor in someone's mortality. So we're in agreement that for the time being, she has established some parameters as far as how much more she's willing to let this grow before she wants to do something about it. And I'm in agreement with her that we will give it some more time. Doing the math and the rate it's going, I'm estimating probably about 3.5 to 4 years. I probably will have to make some sort of decision with this thing. But for now, I'm leaving it alone. So there are two main exams that you can undergo. One is a pulmonary function test, which measures your capacity, the way your lungs process the air, and then, of course, CAT scans, which will pick up any kind of growths on the lungs. It's important when you get released from your oncologist that you get followed up by your primary care doctor. I mentioned the importance with the heart. It's just as important with the lungs. Get a baseline established. Okay, and baseline with a pulmonary function test, get a pulmonary baseline with the lung CAT scan. It was 18 years till I had my first late effect show up. But clearly, especially when it came to my heart, that problem was existing many years before that and just was never picked up. I would have benefited had my primary care doctor been told to watch out for these things, but back then they didn't do that. I'm here to tell you that's the way it needs to be done now. You know, so you get these done, and if your baselines are normal, you go about doing things like normal. And if there is something to be dealt with, you follow it up with a pulmonologist then. And I do want to stress, not everybody gets these late-term side effects. But science is learning that more people are actually getting them than what they thought. And they're just undetected. So I cannot stress enough, please, please have your oncologist recommend to you what needs to be followed up for potential late side effects. Doesn't mean you're going to develop them, but it's better to get ahead of them, just like I'm ahead of with this nodule or anything else that I'm dealing with my lungs. I'm going to continue on with other late effect issues that I'm dealing with the rest of my body. There's a lot more videos to make. Until then, this is Paul's Heart.